So I did my project on type 2 diabetes. Starting with etiology, we have family, lifestyle, environmental factors, and obesity. So with family, we look for familial history of diabetes and cardiovascular disease. As far as lifestyle, we look at smoking, if they exercise or not, what their lifestyle is like as far as work. Does it involve a lot of activity? Are they sedentary? Environmental factors and obesity. As far as environmental factors, things such as healthy food options, or if they're available, what walkability is there? Are there walking trails, etc.? Do they have a mode of transportation to get places? And that brings me to these two pictures. So this is Tops. This is the grocery store in Buffalo that was recently closed after the recent tragedy. And it sparked a huge conversation on food deserts and how that the people in that area, many of whom don't have cars, that whenever that store was closed, they didn't have anywhere to go to get food or basic groceries, anything, because the closest store was over 30 minutes away. And this isn't uncommon. A lot of these towns have like a Dollar General or one of these small stores, and even these stores don't carry fresh fruits and vegetables, fresh meat. And so all of these things just tie into what we're talking about. And it's just very intriguing to see how things that we see in everyday news can affect our patients that we'll be seeing. As far as risk factors, they tie a lot into etiology. So again, obesity, age is also a risk factor, older than 55 years of age. Race is another factor, African American, Hispanic, Native American descent, sedentary lifestyle, physical inactivity. Smoking is another huge risk factor. As far as signs and symptoms go, a lot of these are the same as type 1 diabetes, except for that there is increased weight gain around the abdominal area. So there's hunger, fatigue, thirst, polyuria, and nocturia. Polyuria being excessive urination, nocturia being excessive urination at night. Dry mouth, itchy skin, blurred vision. And one thing that I feel is worth noting is that if we look at these things, especially polyuria and nocturia, with the patients being of an older age, it does put them at risk for falls. You figure frequent nighttime urination, and if they have any of these other symptoms such as blurred vision, or if they're thirsty and getting up more frequently, the more frequently they're getting up, and if they aren't able to walk very well, or if they're in their homes with rugs or whatever, that's a whole nother thing, assessing for fall risks. But all of these things adds an aspect that we need to think about of, does this patient need to be assessed for fall risk? Does their home need to be assessed for precautions, to take precautions for fall risk, removing rugs, things like that. Complications include atherosclerosis, which can lead to CVA and strokes. Then we go to the eyes, cataracts, glaucoma, retinopathy, blindness. This picture over here shows diabetic retinopathy, which is basically caused because the capillaries, the membrane within it hardens, which causes an obstruction, which eventually causes a rupture. And so then there's a similar happening with the capillaries in the kidneys, which is nephropathy. And that can cause kidney disease. And cardiovascular disease, that is also ties into everything else we've discussed and will discuss, such as if you have high blood pressure, if you have high cholesterol, if you're eating high fat foods, if you're not exercising, like all of these things, if you're smoking, it just ties into that cardiovascular disease. If we talk about neuropathy, we're looking at the degeneration of nerve fibers. This leads to urinary incontinence, infertility, numbness, and weakness. Then we talk about peripheral vascular disease. This is caused by plaque buildup on the artery walls, which leads to ulcers, delayed healing, gangrene, and in some cases can lead to amputation. As far as diagnosis and testing goes, screening for people older than 40 who have any risk factors, even those without risk factors. Those with the previous mentioned risk factors, screening is recommended more frequently. Typically, diabetes type 2 is diagnosed with a hemoglobin A1C. Other tests that can be done is a glucose tolerance test or a urine test to see if they're spilling ketones. I thought this was a really good explanation of kind of what a hemoglobin A1C is looking at. So we have all this glucose coming in and hitting these red blood cells. And then this person is not eating healthy, obviously, with all of these donuts coming in. And that has even more sugar in it. So there's glucose coming in from both sides. And the reason why we look for 2 to 3 months when doing a hemoglobin A1C is because those red blood cells have a lifespan of 120 days or 2 to 3 months. As far as prevention and education, regular exercise is always encouraged. We encourage patients to stop smoking or recommend a smoking cessation program. We encourage routine well checkups with doctors, including not just their primary care, but also their dentist, their eye doctor. And if they already have diabetes, we encourage a podiatrist if they have like diabetic feet. Further education includes the importance of glucose management to avoid those further complications. And then there's a common like misunderstanding about eating only sugar-free foods and that will resolve the issue. This is false because carbohydrates also influence blood glucose along with several other things. So sugar-free is not the solution. As far as medical management, diet modification is typically the first step, and they will want you to have a diet with low and saturated fats, carbs, and high fructose corn syrup, and they will want you to increase your intake of fiber and mono unsaturated fats. If that combined with exercise doesn't work, they may prescribe you oral medications such as metformin, or there's numerous others. Insulin replacement may be required, and they will make sure that the patient knows their ABCs of diabetes. So A being that A1C that we talked about, B being the blood pressure. They'll give that patient a range for their blood pressure. And then C being cholesterol, the doctor will give that patient a range that they want their cholesterol to be in. And then S being, again, smoking. They'll give them smoking cessation tips or, again, recommend to stop smoking. I felt that this was a really good diagram that just kind of shows what's going on inside with type 2 diabetes. So the pancreas is producing that sufficient insulin, but the body is resistant to it, so it's not being used effectively. And so the glucose isn't able to enter the body effectively, so those glucose levels are also increasing. As far as nursing management, the number one thing is to assess for skin integrity. I would have to say that is so important, because if we talk about diabetic feet and neuropathy, they are losing feeling. They could have wounds and not know it. And so just looking at their skin and noticing wounds is so important. Perform wound care is prescribed. Assessing the patient's understanding on how to monitor their blood glucose. If they have a machine and they're needing to know how it works, or if they've changed their blood glucose monitoring, just make sure that they understand that. Educating patients on symptoms of hypo and hyperglycemia, even though those are more uncommon with type 2, we want to make sure they know the symptoms and know when it's an emergency situation. As far as prognosis, it varies among patients due to numerous variables, such as lifestyle modifications. Have they been following their diet plan? Have they lost the weight that they've been recommended to lose? Have they added in exercise on a continuous routine? Not just did it for a week or two and then stopped. Have they quit smoking? Did they adhere to medications, whether it be metformin or self-monitoring or insulin, and have they followed it correctly as written? Because that's the only way it'll have beneficial effects. Comorbidities, whether the patient had comorbidities and other conditions before being diagnosed or if they occurred after, these all affect how it can affect how not just diabetes type 2 progresses, but it can impact their general well-being. And then their age. The older the patient is, the increased risk for mortality. And then I thought this poster showed that there's various different forms of exercise that some people might not always think about. As far as research and clinical trials, most of them focus on either prevention or drug-related treatments, but there's a very new study that just came out that shows that those that have insulin resistance and are obese have more GABA on their liver. So if they decrease that GABA on the liver, it showed that it improved glucose uptake and insulin. It improved the glucose uptake and the insulin sensitivity. So the study proposed that we use a GABA inhibitor to solve the same problems that like metformin and all of those other things are using. It has not been formally approved yet. It's still being tested. From what I read, it's only so far been tested on, I think, mice, but it is very intriguing to read about, and it's fairly new. I think it was studied in St. Louis, if I remember correctly, but my resources are attached and it is on here. It is the first one on my reference page, and it is quite an interesting read. And that is my presentation.